everybody. Welcome back to another conversation with the Commissioner. I am here with Deputy Commissioner Eden Beasy, and we want to talk to you about the Rural Health Transformation Program. No better setting than here at the farmers market, where us urbanites get to have some really good fresh vegetables and fruit from across the state here to be delivered, and so supportive of our rural communities and our farming communities. I'm excited about this funding. How about you?
Yeah, me too. And there's been a lot of developments over the past several months. Our regional teams have been meeting weekly, sometimes more often than that, to talk about the things that are important to them in their own communities. They are working on prioritizing what those important issues are. They've been working in work groups to help come up with solutions related to those priorities. We've been shared with their needs assessments, and we're really excited to receive those applications, those full applications in the summer. We just got their letters of intent a few weeks ago, and just the progress that they've made is really inspiring.
Yeah, so we're talking about the GROW Regional Grant. So as a reminder, we divided the state, our rural communities, into 8 different regions, and we've asked those communities to come together, build coalitions, identify what their needs are, and that they're all to submit one application per region, which is, I mean, that's really revolutionary to say just one application, because it really forces people to coordinate and work together. And so as Eden mentioned, those are due on July 1st. So we're really kind of coming up there to that time. We're so excited to see what they've come up with. And they're going to be addressing pre and postnatal care, chronic disease prevention, access to healthcare, food access, speaking of food access, transportation access, and I know there's several other things, mental health, improving technology in the healthcare system. I think what I'm really inspired about too in talking with the coalitions is their commitment to working more closely together. We know that sometimes there isn't actually a need for more resources. It's just resources working better together and put families at the center of healthcare rather than families having to navigate all these different healthcare issues on their own. Collaboration is the name of the game. That's
so
right,
we're sharing with them what the important things that we want to see in their application, and really the important thing is working together. And so far so good on that front, and looking forward to seeing what they come up with.
Yeah, so after we receive those applications, we're really quickly going to review them. We're going to let the communities know what their award is. And I think, too, to mention that there's a competitive component of this. So where every region knows their base of how much funding they're set to receive, they're also competing for additional funding. So where we see a high level of collaboration, some really good innovation, some transformation, then they're available for additional funding. And then as we move through this process over the next 5 years, we're going to continue to evaluate, are we getting out of this what we want from it? What is the ROI? And then sharing between the regions, so that if, let's say one of the regions is just really seeing great infant mortality improvement outcomes, prenatal care access, to share that good story and what is that initiative with the rest of the regions. And that still leaves opportunity for them to, to do the same thing and to expand it statewide. So it's like we're going to have 8 pilot sites really to transform care. So I'm pretty confident that 5 years from now, rural Indiana is going to look different.
Yeah, we're sincerely going to leapfrog into the next 5 years. And it's been really inspiring to see these organizations and communities really coming together to figure out what that means for them and what's going to really impact the health outcomes for their communities.
Yep, we'll continue to keep people updated on outcomes and progress. And just to really quickly mention that this is 60% of the funding, 40% of the dollars is going to statewide initiatives. We are well on our way with those. There's lots of proposals that are out there as we're bringing people to the table to help implement solutions, to help improve our clinical workforce out in communities. How do we engage kids as young as high school? That healthcare and working and staying in their rural community is an option for them. Exposure to what that looks like. How are we improving our trauma care system and the movement of patients between hospitals and throughout our rural community? Mobile integrated health. I mean, there's so many things we can go on and on.
Interoperability.
Yes, interoperability, health data sharing, recognizing that each of us as an individual, we don't just interact with one healthcare place, one hospital. And so making sure that your healthcare data is available. So lots of things to come. We are making progress, but excited to see those regional grants. And we'll keep on providing all this information on our website. So please check that out and hold us accountable to how we're doing. We're really excited. We're happy to work with our stakeholders, and we'll see you next time.
That's right.
Yeah. Bye, everybody.